My name is Julie Larson, and I'm covering a little bit more from the Fast Track course. I decided not to use the PowerPoint slides right now. You can always look at them later. I'm just going to go over a little bit about Chapter 2, the childbearing year. This is a book that we're using. Now, the first trimester, it goes over different things. I had to take off my glasses in order to read. So the first trimester, we talk about how hard is that for a mother. First, second, and third month. Usually during the first 3 months of a woman's pregnancy, she's got a lot of nausea, and sometimes she can't eat. Sometimes the woman develops some issues where they really get severe need to go see a doctor. I have a hard time pronouncing that particular word. It's hyperis. Well, anyway, I'll write it down and put it in under the video. But anyway, it's usually when the mother gets like really dehydrated because she's vomiting and stuff a lot, and so she has to go and get IVs and food and intake from the hospital because it's a very severe condition. And we want you to be aware that there are some conditions where a mother may have to be hospitalized during pregnancy. So that's one of them, where she gets really severely dehydrated and things like that. And sometimes the mother has that problem through the whole pregnancy. So it's good that if you have a high-risk mother, that she knows that she can get help from her doctor and hospital. And the second trimester of pregnancy is usually a more fun time. The mother is able to do more things, but her belly starts growing a little bit more in the 4th and 5th and 6th month. Around the 5th month, the mother may feel a quickening where she starts to feel the baby kicking and things like that. So it depends on when the mother feels the baby moving. And the third trimester is usually when the woman will start considering hiring you as a doula. So usually doulas don't really help with the first and second trimester so much. However, there are some bed rest doulas that may help more with the earlier pregnancies, depending on the mother. And then the rest of this chapter kind of goes over a little bit about the mother's system, like the blood volume will increase as the mother gets more pregnant, and the blood volume level should be checked around that time. And it's good to know the iron levels of the mother, because I was anemic for some of my pregnancies, and it's very important to check that and anemic level. See if you have enough iron in your diet. We're going to talk about more about being a nutritional doula in one of our future modules. And some of this chapter even goes over a little bit about early labor and pushing stage. So if you want to, you can look at that over. But this book doesn't really have a lot about the stages of labor that I would like it to. So what I do is I borrowed from Millie Hill. She gave me permission to use her second chapter of her book, the Positive Birth book, and so we go over more about like the stages of labor in that section. And in conclusion of this little section is we have a case study in the module, and then the next section we talk about letting go of fears in the course on the PowerPoint slides. And I think it's important just to read through that, and the exercise is important about letting go of fears. What I usually do is I'm going to practice just a little bit here about letting go of fears. You'll have a mother kind of sit and then deeply breathe in a few times. And then the mother will just sit and relax, and she'll try to maybe she might talk to you about some of her fears to begin with. And then I usually have her write down her fears, because I think it's good to write it down. Write it down on a piece of paper, what she's fearful of. And then the next step to letting go of fears is usually that piece of paper that she wrote on. She'll either tear it up and throw it away, or maybe she'll She'll get a match and burn it if she wants to. Just anything that'll help her kind of like, okay, I'm releasing this fear to